Hello, my name is Marisa Srestha. My student ID is U32219007 and this is my student ID. Today I'm filming my Oscar video presentation of Part A for this given case study. Before conducting any assessment, I will introduce myself to my patient by saying, hello, I'm Marisa, nurse looking after you today. And after that, I will check patient's identification to make sure it is the right patient by checking ID band, date of birth, and MRN number. I will ask for consent of my patient before conducting assessment, and after explaining everything about the assessment, I will perform hand hygiene to prevent cross-infection. So utilizing the information that is available in the given scenario, I'm going to outline 3 clinical nursing assessments that I will do for my patient. Initially, I will do A to G assessment by inspecting, auscultating, and palpating, because A to G assessment will help me to get primary observation of patient's condition and also recognizing the sign and symptom of deterioration. In regards to focused nursing assessment, I will do respiratory assessment by inspecting, auscultating, and palpating to identify respiratory rate, rhythm, and depth, to identify respiratory effort or use of accessory muscles when breathing, to detect abnormal lung sounds like wheezes and stridor, including monitoring of oxygen saturation, and to monitor chest expansion and symmetry of chest. My rationale to do respiratory chest on joint is because when approaching joint, he states that he cannot catch his breath and is diaphoretic. Furthermore, I will do neurological assessment by using Glasgow Coma Scale, because it will help me to determine patient's level of consciousness, pupillary reaction, motor function, sensory function, and any abnormal vital signs. My rationale to do neurological assessment on John is because, as per scenario, John's head struck the concrete and John was drowsy and confused after the fall and has suffered from small subdural hematoma. So ongoing neurological assessment will help to determine early recognition of neurological deterioration, especially after his fall. Finally, I will do pain assessment using PQRST tool, because it will help me to get better understanding of his pain and to determine possible source of pain. My rationale for doing pain assessment on joint is because he is grimacing in pain and he has a fracture of right radius, superficial abrasions and bruising, and also fractured ribs. He's also rubbing left side of his chest because of pain, and he has persisting ongoing pain as per Muse chart. In terms of EASE-bar, I'm going to hand over my patient to the nurse who is taking over from me at morning tea, and I will be saying, hello, I'm Marisa, Jones night nurse in medical ward at ABC Hospital. I have double-checked my patient's identification by checking his name, date of birth, and MRN number to make sure it's the right patient. The situation is patient is diaphoretic and has dyspnea, as he states that he can't catch the breath and is grimacing in pain, rubbing left side of his chest. John is 48 years old gentleman who was transported by ambulance in emergency department after standing height fall, which led to left side of John's head struck to the concrete. And John was drowsy and confused after the fall. He has nil known allergy to any food and medication. I did A to G assessment on John, and I have done the full respiratory assessment, neurological assessment, and pain assessment. Patient complained of dyspnea and diaphoretic, and he's diaphoretic and is grimacing in pain and rubbing his left side of the chest. He is under continuous monitoring of vital signs, including O2 saturation. After a number of diagnostic tests, it has been concluded that John has suffered a small subdural hematoma, a fracture of the radius, superficial abrasion and bruising, and a fractured rib. Back slab has been applied to his upper limb to immobile the injured limb, and an appropriate analgesia has been administered as charted for his pain. In recommendation, I have informed MO and team leader to review the patient. I have referred physiotherapist, so it helped John for faster and more complete functional recovery from fracture. I have referred to tissue viable nurse and wound specialist, because he has superficial abrasion and bruising. I have also referred patient to clinical psychologist to determine if there is any neurological or cognitive deterioration following fall and persisting subdural hematoma. I will also advocate for chest X-ray and brain CT scan, because he's persistently having chest pain right now, and then because of the history of his confusion. I will advocate for alcohol withdrawal scale because of the history of intoxication. So I would like you to continuously monitor patients, full set of vital signs, neurological assessment, and pain assessment to recognize deterioration and improvement on patient. Thank you.